Hello, everyone, and welcome to this crucial discussion on women's cancer. Today, we focus on the power of early detection, advancements in treatment, and the role of awareness in saving lives in this virtual section. Think Pink, Act Now, Screen, Fight, Win. Organized by Voice of Healthcare and Cadila Pharmaceuticals. Despite medical progress, many women face barriers in screening due to fear, misinformation, or lack of access. How can we break these barriers, especially in underserved communities? How can we ensure that innovations like genetic testing, precision medicine, AI driven diagnostics reach everyone? Beyond treatment, cancer care must address emotional and psychological well being as well. Support systems and education are just as vital as medical breakthroughs. We are honored to have Dr. Srikant Tiwari, radiation oncologist, Sagar Multi Speciality Hospital, Bhopal, with us today, who will share his insights and latest advancements shaping the future of women's cancer care. Let's engage, learn, and work towards a world where prevention and early intervention make cancer less of a threat. Welcome, Dr. Srikant.
Thank you, ma'am. Thank you.
I'm Dr. Manisha. I'm your host for the day. Sir, please tell me that why is early detection so critical in improving cancer survival rate? And can you share some real life cases where early diagnosis made a significant difference?
Each if you see each and every there are a variety of 100 variety of cancers, and especially in women, the breast cancer, which is the most common cancer, the second most common cancer, the cervical cancer, especially in the rural area, or ovarian cancer and endometrial cancer in the older age group. And if you see these cancer, the incidence wise, the incidence of this cancer are more in Western population or American population than in Indian population. But if you see the mortality, the death rates are very high in Indian populations. The reason being, in India, most of these cancers are diagnosed in late stage, whereas in Western world or in US, most of these cancers are diagnosed in early stage. So you can understand the importance of the critical timing of diagnosis. So if any cancer diagnosed at early stage, the chances of cures are very high. And if the cancers are diagnosed in advanced stage or metastatic stage, stage 4, then despite having best of effort, we cannot cure the cancer and the mortality will increase. So detection of cancer at early stage is very important. I'm giving one or two example, like in cervical cancer, which is one of the most common cancer in Indian rural area. If the cancer are diagnosed in a stage 1 or 2, the 5-year survival rate is more than 90%. But if the cancer are diagnosed in stage 4, then the 5-year survival is only 5%. So you can imagine the data, the similar things happening, the similar stories for the breast cancer, similar story for the ovarian cancer, or any gynecological malignancies.
Correct. So early diagnosis, it can cure the cancer and you have to detect it early. That's the only way out. But what I feel is that there are certain barriers, and especially women in seeking help to, all the screening programs, especially the mammograms and the pap smears and the genetic testing. How can we break these barriers, especially in rural and underserved communities?
There are you can enumerate the many barriers, especially for the rural area. The illiteracy is one of the importance. It's not only the rural area but also in the urban areas. Many people who are having all the means, all the resources, but due to illiteracy, they cannot go for the screening test. Apart from this, the lack of awareness, the availability of facilities, this is an important barrier in the rural area, because many facilities which is required for the early screening of the cancer, so that the cancer, if happened, can be diagnosed early, that facilities are not there. So the illiteracy, poverty, lack of awareness, availability of the facilities, these are an important barriers.
Correct. So availability of facilities, definitely I agree that we have to ramp up our healthcare system and the availability should be more. Apart from that, many women fear cancer screening, maybe due to myths or misinformation. How can healthcare professionals encourage routine checkups without causing any unnecessary anxiety?
The most important the fear or myth in the society is the cancer word itself. If anyone feel, yeah, that they are going for the screening of cancer, then they say that, oh, I don't want these things, because the people want to avoid, they want to keep themselves away from this word, which is not right. So here, I can say the illiteracy play a very important role in promoting such type of myths. So if I our the primary healthcare workers, especially the psychologists, should be there along with that, who can counsel them that regarding like other disease, the cancer is also a curable disease if it can diagnose in early stage. There is no stigma, it is not an stigma, it can happen to anyone. So in that case, we can calm and compose the patients and encourage them to participate in the mass screening program.
I agree, sir. So, fear around the word cancer, that should be removed. Also, family history play a very important role, and especially around women cancer risk. So, how can genetic testing help in proactive healthcare?
Genetic testing is a special type of test that is not required for the general human being in the society. It is required for those patients who have either a strong family history of having any particular cancers like breast cancer or ovarian cancer in case of female, or if any patient is diagnosed cancer and after evaluation it is found that there is certain variety of cancer, there is particular variety of cancer who are very prone to be genetic. In such type of patients, the genetic testing should be done. The importance of genetic testing is that it cannot the prevent of occurrence of cancer, but if we can know that who are at high risk, that patient should be enrolled early for the screening program, and if any cancer will happen, it will be detected in early stage and it can be cured.
Right, sir. So, we have to do aggressive screening, especially for those who are at higher risk as compared to the general population. So, what, according to you, are the most promising breakthroughs, especially in breast, cervical, and ovarian cancer treatment today?
If you go 5 years back, the treatment options for ovarian cancer, cervical cancer, and breast cancer are mainly surgery and chemotherapy and radiotherapy. But nowadays there are a lot of advancement in the treatment of cancers, all cancer, and there is a lot of advancement for the gynecological cancers, the breast, ovarian, and cervical cancers, in the form of immunotherapy or targeted therapy. If radiotherapy is required, there is very high precision radiotherapy is available. Now we are moving towards the reason, I think in another 5 years or so, might be we have so much effective treatment will be available, especially for the breast cancer, and in near future might be the surgery for the breast cancer will not be required. So the body distortions which especially happen in the younger age group, in breast cancer patients, the patients might get rid of that also.
All right. And what major advancement do you see in the field of radiation oncology? What do you feel that is the most advanced, treatment option available nowadays?
So now the radiation techniques has been advanced, the better quality of machines are now there, so the precision radiotherapy like in India, if you say head and neck cancer is still is very high, although it's more common in male, but in female also, because the local tobacco chewing is very common in different part, especially in the rural world. So what happened before, when we go for radiotherapy in such patients, then the long lasting trismus developed patient cannot open his mouth, or the dryness of mouth happens permanently. But nowadays, due to the precision radiotherapy, IMRT or IGRT techniques, the radiation effect happen only on the tumor sites and not on the general area of the body, so the side effects are very minimized.
Correct. So we can spare the healthy tissue around the tumor. That's
Yes.
correct, sir. That's
Yeah.
correct. Also, AI and technology is like coming up in every field, and we believe that diagnostic is also one field where it's playing quite big role. So, what do you think that the home-based or non-invasive screening methods for women cancer would they be accepted, and we are where like?
Yeah, I think so. It is in coming days or coming years. We will move towards for most of the diagnostics test, especially biopsies. Look, it's very important that many patients feel that if you'll go for biopsy because it's invasive test, the tumor will spread out exponentially. So patients don't want to undergo biopsy. So I think in coming days, there's a variety of new techniques are developing that can capture the up to the genetic level, up to the, I can say up to the genetic level, so that the biopsy or other invasive test for the diagnosis of cancer will not be required.
And since you're talking about the genetic testing, and genetic testing is not only used in screening like cervical screening, we have seen that HPV virus molecular testings are widely available along with the Pap smear. I feel that genetic testing is being used for personalized treatment plans as well, and helps us to tailor the treatment for a particular patient. So, what do you think that are these accessible to wider, population in India, and what's the future like for precision medicine in women cancer?
It is not yet available widely for the general population, but I think the way the healthcare sectors are spreading out in coming days, I think these tests will be available to the rural area also, because now there are many hospitals or labs, because of the participation of the private government sector collaborations. The many satellite labs or hospitals are opening up in the rural area, in the tier 3 city or tier 4 city also, so that such type of facilities should be accessible to those who are also still residing in the rural area. So I think in coming future, all this facility will be available. If the government will focus on this facility will be available to the widespread general population.
Right. And if we talk about the targeted therapy, immunotherapy, and all the new modalities which are there for cancer treatment, what according to you has shown the most promise, and which cancer?
Immunotherapy, I can say nowadays we are moving away from the chemotherapy, because the chemotherapy has a lot of toxicity and patients are very apprehensive if we plan for chemotherapy, because before we starting chemotherapy, we have to explain all the pros and cons of chemotherapy. But the immunotherapy and even the targeted therapy also, they are more effective, they are more precise, and they have very few adverse effects which can be easily tolerable to the patients. So the patient compliance are increasing. The only the barrier with this immunotherapy and targeted therapy is that still it is little bit costlier for our population, and is not therefore it's not accessible to all the population. But I hope the cost will decrease soon, and once it will be widespread available, it will be wonderful. And if we are moving towards because this immunotherapy are so active and the result are so good, that we are moving towards that the surgery might not be required, or sometimes radiotherapy might not be required. What we are using today, that surgery is like in breast cancer, the surgery is still required. In cancer of large intestine, surgery is still required. But we are moving towards in the era where the surgery will no longer be required after the immunotherapy or targeted therapy.
Right. So you have enumerated few cancers wherein you feel that immunotherapy and targeted therapy, they are doing good. That is breast and colorectal cancers and intestinal cancers. So moving on, I would like to ask you that there are many myths around, cancer. So how can we dispel those dangerous myths around cancer, and especially, educate women so that they should not be fear around the word cancer.
The only things to remove all these myths from the society is that we should make the society more literate. The lack of awareness is there, so we should spread the awareness through different the NGOs or whatever the facilities available. I think the spreading of awareness about the cancers, the importance of early diagnosis, the importance of treatments, and to convey them that it's like other disease, it's also a curable disease. Like if patient, any patient will have malaria, it can be cured. Similarly, if patients can have cancer, it will also be cured like malaria if it will be diagnosed in early stage. So the only things we can do is to improve the awareness among the general public that the cancer is like other disease and it can be cured very easily.
Correct. And since you have been practicing, oncology for some time, quite some time, I just need to know that have you come across any patient, with a myth which you believe can be dispelled easily and patient should be educated? Tell us one myth which you have come across and which patients feel that, is causing fear.
I'm telling you, madam, I have encountered with many patients, and
Okay.
in fact, I'm telling you, one of my patients encountered around 4 5 years before. She was diagnosed as early stage breast cancer. She was a young lady having one young child of 2 or 3 years, and even after proper counseling, I don't know who told her to what, and she refused to undergo chemotherapy and surgery because
Okay.
the fear of the hair fall only. Although she was homemaker, she was not working anywhere, she was homemaker, but she refused to because in such type of situation many relative and all these things, they became doctor and they the power a lot of advice to the patients. And late after one year, she came on a stretcher because the disease was spread everywhere. The multiple bones were involved. She came on a stretcher and she regretted that at that time, mistake I have done, now I will not do any mistake. Although this patient is still alive, because as I told that we have a lot of new modality of treatments options are available, especially in the breast cancer patients. So still she is alive, but now her disease cannot be cured. She will be on the treatment till the end of her life.
Correct. So I think we should not, listen to these facts that if there are some side effects involved, we should always seek help. We should always go in for the treatment, especially for the early stage disease, which has been caught by early detection, which is very important because it's always curative. Once it metastasizes, then it becomes difficult. Very good example, sir. So also there are certain lifestyle factors, of which I believe that if they are modified, we can do something about the cancer. So can you tell us about those factors, especially in women cancer, which help us to modify the disease?
The cancer, if you see the risk factor of cancer, almost 90% of cancers are related with the lifestyle. Very few cancers are not related with the lifestyle, like the cervical cancer, where the virus is an important cause, or the liver cancer, where the virus is an important cause. Otherwise, if you see all other cancers from head and neck to lung cancer to breast cancer, if you see all the gynecological cancer, the breast cancer, ovarian cancer, or uterine cancers, these all cancers are directly or indirectly related to the lifestyle. Like the incidence of breast cancers are increasing in our part of the world. It's because we are now adopting the Western cultures, having late marriage, late the birth of first child, no breastfeeding, excessive use of junk foods, busy life, no time for exercise or yoga and all these things. So these are the important factors. If you modify all these factors, what is in your hand, apart from the look, the genetic risk is different, you cannot modify that, but those risk factors which you can modify easily, like if you can maintain a balanced diet, you can do regular exercise, you cannot be overweight, you can maintain your weight, do exercise regularly, marriage at the proper time, childbirth at the proper time, do proper breastfeeding to the baby. So all these factors will reduces the risk of not only breast cancers but the ovarian cancer, uterine cancer, gynecological cancer. It is usually the hormonal dependent cancers. So they all are directly or indirectly linked to the lifestyle. So if you maintain your lifestyle, if you have habit of good lifestyle, 80% chance that you will reduce the risk of having cancer.
Right, especially the breastfeeding is very important. You've touched a
Yeah.
very important point, and I believe that awareness around breastfeeding should be there, and women should be educated around breastfeeding to prevent, because it's also one of the ways of preventing cancer. Right, sir. And what can support group? What can awareness campaigns do to educate women, according to you?
Normally, look, when the patient has footfall on our hospital, we have separate section, especially for the breast cancer patients. There is a breast clinic which we run regularly, and whenever we do the camps for the awareness of the society, we usually always keep a session for the females, because the number of female breast cancer and other cancers are increasing in the female. So we try to keep a session for the females. We try to arrange a camp in the schools or in the colleges, so that the new generation should be learn these things. They should be keep themselves away from the different myths, and they should know the importance of early screening and early detection of the cancer, so that they can, even if cancer will happen, it can be cured.
Correct, sir. And what, according to you, if we talk about the research, cancer research, what, according to you, is the most promising advancement, and how do you see the future? And do you think that cancer can become preventable or curable in coming time?
Look, now today we are in the era of precision medicines. So we are moving towards the genetic level of testing. So the genetic test is available for those patients or family where the risk of cancer is high. If there is one or two first or second degree relative is having cancer, for general populations, yes, it is the guidelines is there, especially for few cancers like head and neck, which cancers are more common in India: head and neck cancer, cervical cancer, breast cancer, ovarian cancer. For such cancers, if you see, two-thirds of the cancers in females are because of the these cancers. So the clear-cut guidelines are available. We always try to aware the patients regarding the benefit of these things. So I think there is too much advancement, and in the future, as I say, that the non-invasive tests are coming, which can diagnose the cancer even without putting a single needle on the patient's body. So I think the future is very promising, and the investigation modality are developing, the treatment tools are developing. So I think the future is, although the incidence of cancer is also increasing in the same way, but I hope the future is good. The only thing
Right.
is the awareness is very important. We should keep the patients and society aware for that.
Correct. And in your hospitals, have you taken certain steps, Dr. Shrikant? Dr. Shrikant, can you hear me, sir?
Yeah, please go ahead.
Yes. So I was curious that in your hospital, have you taken any steps for these kind of awareness programs or screening programs, or have you formed any package in your hospital so that you can attract more people to get screened early and get detected early?
Yes, ma'am. We have program. We are running breast cancer clinic regularly for those patients who are having breast cancer, or for their family member also. Like today, I have just encountered with one young unmarried female. She had breast cancer. Her mother had history of breast cancer in 1999, and her mausi also has the breast cancer in the 2010. The Mosi is alive, but mother unfortunately died. Now she is unmarried, working female, and she had just breast cancer. So I just counsel her. Then I sent her to the our counseling team, our genetic counseling team, so that she should go through all these tests, and she should know the importance of this test. Similarly, for cervical cancer, also we always we just put a standee everywhere in the hospital that what is the importance of why we should go for the pap smear testing every yearly or every 3 yearly. So such type of awareness we try to continue in our hospital.
Correct. And I also believe that the emotional support is required during cancer treatment. So, how do you address those? How do we need to integrate more psychological care into oncology?
Yes, without emotional support and family support, the treatment of cancer cannot be completed and cannot be successful. So, whenever we plan for the treatment, we always ask three, four factors that the patient should have at least some financial support, or if financial support is not there, at least the financial support from the government side, sides like the Ayushman Bharat Yojana, what is the common in India. Uh, and the second things, the patient himself or herself should be willing for the treatment. She should have confidence that if she will take treatment, she will be cured. And third important things, the family support and emotional support. That is very important. So one emotional support we give as a treating physician, we give to the patients. And the other family emotional support we always seek from the family members to the patients. That's very important.
Right, sir. And my last question would definitely be about your advice to women of today, that how can they take charge of themselves and how can they reduce their cancer risk and improve their overall health.
As I said before, ma'am, 80 to 90% of cancers are directly, especially I'm talking about the female cancers, directly linked with the lifestyle. So if we do a modification in lifestyle in our busy schedule, if you can put some time for our regular exercise and yoga, and keep
I think there is some network issue. Dr. Srikant. Dr. Srikant?
yeah, actually
Yeah.
number of phones are
All
coming
right.
again and again.
No
So
problem.
keep our
So,
body weight maintained. So in that way we can reduces the risk of cancers very easily.
right. So, on that note, I would definitely take away this message that we should take care of ourselves, get ourselves screened, get the cancer detected early because it's curable. Don't listen to any myths, or don't be fear. Fear should not linger with the word cancer, as you have told, and get yourself screened and take your charge. Thank you so much for joining us today.
Thank you. Thank you.